we've got three speakers today. We've got first up Jen Cohan, who's the head of our coaching academy and has led the Coaching for Safe and Continuously Improving Culture programme that we started last year. Anita Williams, who's a care manager from Liverpool, about her experience of being on the Coaching Academy and working with us. And Alison Jones, who's a fellow with West Midlands Academic Health Science Network on the Learning from Excellence work that they're leading nationally. So I'll hand over to Jen.
Great, thank you, Mandy. So welcome everyone. I'm really excited today to talk a little bit about the Coaching for Culture work that we've been doing with the Patient Safety Collaborative. And so just to give you a little snippet about who we are and my team. So I work with Mandy's team at the Innovation Agency, but my team is the Improvement and Education team. So we were sort of commissioned by our colleagues to do this work, which was really, really nice. So what we do at the Coaching Academy is we're really here to help professionals improve culture, quality, and safety through structured, focused interactions, but it's really important to us that the learners drive their own work and their own learning, embedding it into their daily life. So that's a little bit about us from the Coaching Academy. Let's see here. There we go. So why focus on culture? I think that, you know, in your lives in this health and care world, you have a lot of pressures, and it's a really high stakes environment. We know, but some of the research that we've had, some of it from the Patient Safety Collaborative itself, has really pointed out that there are strong correlations between bullying, staff-reported bullying, negatively reported experiences of care by patients, basically behaviors that are compromising patient safety, and then also that some of the research has revealed that the culture is one of more fear and compliance rather than learning, innovation, and participation. So that's the shift we really want to make, that we really want to help folks make within their own health and care cultures, to shift away from being afraid to say, you know, I'm not sure if I'm doing this right. Can you help me figure out how to do this better? And really opening up that community to a shared learning objective. So within our Coaching for a Safe and Continuously Improving Workplace Culture program, we have 4 key components. The first part of it is that we provide coach training for the team leader. And so this year, all of the team leaders went through the ILM Level 5 coaching accreditation process. This cohort, we're making a change, so I'll tell you a little bit about the cohort that's coming up and the opportunity that's there. We're going to provide our own coach training for this next year. And so what that looks like is folks coming together, learning about what does coaching look like, what are the skills and behaviors that are aligned with the coaching mindset, you know, the idea that the coach is truly in service to the folks they're working with, and it's really driven around reflective practice. So that coach then is enabled to work with their teams throughout the process to help drive that learning forward. So the next component is an organizational culture diagnostic that we use. So that tool is the SCORE safety tool, and that comes to us from Safe and Reliable Healthcare, and we can provide some additional, you know, documents and links to help point you towards those materials. But essentially what happens is, and we'll talk about the diagnostic here in a second, but we administer it first with the groups and their colleagues, get a baseline for sort of where their cultures are in a variety of different domains, and then throughout the cohort we look at those results, we debrief with colleagues and choose some improvement projects to move forward to improve culture. And then at the end we assess again and see what kind of movement we've made. The third element of the program is really around quality improvement tools, helping folks understand how to embed PDSA cycles, plan, do, study, act cycles within their work, evaluate the progress that they're making, and try to use some evidence to drive decisions going forward. And then, really importantly, the fourth component of this program is all around communities of practice. So it's very clear from lots and lots of studies over time that communities learn together better when everyone feels that they have a voice. And so much of this work, we're not doing culture work to anyone. It's so much about, it's with the people that we work with, and frankly the patients and families that we work with as well, to make everybody's experience much safer and happier, bringing joy to your work. So, looking forward here. So here's a picture of our most recent cohort that has gone through the program. But again, just to recap, we use the coaching tool, coaching as a tool for improvement. We apply the workplace culture diagnostic. We reflect on that process. The team works together to really understand how their culture impacts the safety culture within their organizations. We explore evidence-based practices, and then review how to keep it moving forward and sustainable. So this is an image that reflects those domains that I talked about in our culture diagnostic. So it's the domains really fall into two different categories, the learning system and the culture itself. Now you'll notice that the overlapping segment is leadership. So I'll start there. So leadership is really about that facilitating the teamwork. Psychological safety is a really important core principle of our whole culture program in order to create an environment where people feel like they can raise concerns and questions. Accountability is, making sure that we are accountable to our communities, but in a really respectful manner. Getting the support that we need, teamwork and communication. This is an area that most of our teams really chose to focus on throughout the cohort. Shared understanding, agreed methods, how do we handle conflict. Negotiation is again about everyone having a voice and gaining genuine agreement. So then, if taking those culture domains, we apply this cycle of continuous learning. We're always learning. We're never done. We're never done working on culture. It's really important that we're measuring our improvement and we're not relying solely on anecdotal evidence, applying best practice, things we know already work, and openly sharing with others so that we can improve. And I think that was one of the things that we learned a lot from this cohort, is that we had 7 different teams from very different regions, but who all could share experiences and learn from each other. So some of the outcomes listed here, we've got, there are more of them. These I just kind of pulled a few to share with you. Again, understanding that really key relationship between psychological safety and patient safety, formulating a plan and working through that plan. So just to give you a little bit of a heads up that we have a new cohort that's starting this April. For the team coaches, the cohort for teams starts in May. The applications are open now. All the information is on our website. If you go to the Innovation Agency website and click on Supporting Innovation, you'll find a Coaching Academy link. All the information is there. But again, as Mandy said, we're really focusing on some of those areas for the Patient Safety Collaborative, particularly deterioration, maternity and neonatal, and medicine safety. So you can see some of the dates that we have coming up. So that's just a little bit of an overview about our cohort. But I want to pass it over to Anita, unless Mandy, you want to jump in?
Just before we hand over to Anita, can I remind you that if you've got questions, then the Q&A is at the end after all of the speakers. So, Anita,
I'm here. Thanks very much. Good afternoon, everyone. And thanks, Mandy and Jen, for asking me to come and share my experience of working with the Innovation Agency Coaching Academy. I got involved in this by enrolling in the program Jen just described. By way of introduction, I am a speech and language therapist, but for the past 3 years, I've been an operational manager for district nurses, matrons, specialist nurses, and health visitors. At the time I applied for this program, our district nursing teams were experiencing a difficult and demoralising time. Liverpool Community Health NHS Trust had been found to be requiring improvement by CQC. And there was in fact very little development available while the trust was being wound down. The process of being taken over took 4 years. We seemed to be in crisis every day. Staff felt unsupported and resisted any form of engagement. The sentence, management does not care, was echoed daily, and nurses wouldn't raise concerns because they felt that they wouldn't be supported, which is a point Jen just made in her introduction. Resilience levels were very poor, and the sickness levels in our locality were up to 29%. And the organisational response at the time, response to these matters was a bit of a sticking plaster. They were moving staff around, they were trying to keep shifts going with overtime and bank and agency staff. I mention this because in the context of my previous role as speech therapy manager, I was dealing with an 80-week waiting list, and I had virtually no staff. And so we were forced to question absolutely everything that we believed in and did. As an AHP, I struggled to understand the culture and beliefs of district nurses, and I searched for a tool which would, thanks Mandy for the water, which would help me to explore these. District nursing teams acknowledged and accepted the expectation that they should continue to take on more and more work, even when there could be no positive clinical outcome. The concept that duty of care means the most good and the least harm was not accepted, and my early questioning about this was perceived to be potentially dangerous. So I attended other programs, but I didn't feel that I could take something on as big as this without support. And I like this program because the Coaching Academy offered direction and ongoing support. Oh, I've gone too fast with the slip. Sorry about that. Back again. So the program lasts about a year, and it's structured around a comprehensive questionnaire which is repeated at the end. This explores staff culture, beliefs and behaviours. Our working team consists of myself, our locality district nurse team leads, and there are 5 teams, another care manager and a clinical lead. Personally, as team lead for the project, I've been supported closely by the Coaching Academy with talk sessions, role play and online or telephone supervision. The plan is that I will gain an ILM Level 5 coaching qualification, and this has involved reading and essay writing with materials that are readily available on the Coaching Academy website. The rest of the team gets 5 development days with the Innovation Agency, and I also get to practice my burgeoning coaching skills with them, and they've been very gracious about this, and I have to thank them, and I do thank them regularly. So I have to admit that at the beginning of the program, I too needed to change my own perceptions and beliefs. I didn't really understand what coaching is, and I thought that it was another term for mentoring. But I never had any formal mentoring training, so that was fine as far as I was concerned. So, however, I discovered that it's something very different. And I got to understand that the value it has as a discipline in facilitating the thought, reflection and space needed to bring innovation and long-lasting change from digging within. And I kind of need to add that as an organisation previously we had a lot of mentoring, and that can only bring very quick turnover and change, but we really needed that long-lasting effect that coaching delivers. Armed with all this new theoretical learning, we met for our first group session hosted by the Academy. I knew everyone, but I still felt that I'd jumped into the deep end of the swimming pool. Would we sink or would we swim? Fortunately, the sessions worked out and gave us the motivation and commitment to get some true and measurable evidence about how our staff were faring. With the support of the Coaching Academy, we worked hard at persuading all our district nurses from the 5 teams to respond to our online survey. And we were swimming, and we were absolutely delighted to get an 82% response rate, which I hope you'll acknowledge is pretty amazing. So the responses were quite demoralising, but I found that their detail was instructive and quite exciting. I'm a great believer, the only way is up. Something that was tangible, it was measurable, something that we could get our teeth into. However, the district nurse team leads found this quite depressing, and they found it really quite painful. And the Coaching Academy provided us with the support we needed to get through this difficult time, with the knowledge that we had to tackle these problems with acceptance and courage. By this time, we worked for Mersey NHS Foundation Trust. And we took our results to our senior management team. Much to my relief, their response was both encouraging and supportive. In the weeks after taking over our division, Mersey had formulated a new set of values for our new and larger organisation. These commit us to being continuously improving, accountable, respectful, enthusiastic and supportive. Our survey gave us all the evidence that we needed to work on these values. With these in mind, we agreed to tackle the top 2 areas of concern, staff burnout and team working. And I noticed that Jen pointed out that actually everybody tried to deal with staff burnout. It was really informative, the information we got from the survey. Mersey as an organisation supports the use of coaching at all levels of staffing, and our organisational effectiveness team helped us to set up some group engagement sessions with staff in order to explore their responses to the survey. Staff attended in good numbers, and they displayed courageous honesty. That's the only way I can describe it. They were amazing. The coaching skills that were introduced ensured that the sessions were cathartic but also constructive. We took the findings on board, and we engaged in one-to-one and group coaching sessions to work on ways of addressing the causes of staff burnout and poor team working. We're now halfway through this process, this journey, but we've started to introduce some new ideas and practices. The district nurse team leads, on their part, recognise that they're in a better place than before the programme. They feel that having had that time out in a structured coaching session with the Coaching Academy has given them the time and the opportunity to reflect on practice. They also feel that they've benefited from meeting other health professionals, which Jen pointed out was 17. I never counted them, 17. So professionals from other sectors, some in the acute, some in community, all dealing with similar issues but developing separate approaches. Additionally, the coaching has given us the space to reflect on the links between cultures, behaviours and policies, preparing us for our next journey into the just and learning culture work which we're about to embark on with Mersey Care. Examples of some of those changes we've introduced are clear break-ins, work schedules, fixed weekends for those who want them, the introduction of professional forums for individual district nursing roles, And we're now more proactive at ensuring that we share positive stories and recognise staff for their hard work and positive contribution, which I have to say often goes well above and beyond their duties. And as managers, we strive to be more visible and not just at a time of crisis. We soon will be introducing group supervision and individual one-to-one supervision programs for all the district nurses. And we hope that this will address staff burnout as well as introduce safer practice. Mersey Care has been enthusiastically supportive of our efforts, and we're looking at how we can share our experiences with the rest of our district nursing teams. Personally, I've now completed all of the coaching academy sessions, and though I'm rather depressingly still a few reflection essays short of the coaching qualification, and can I say, if Pam's ever listening to this, I'm really sorry, but I will get there. I will get there, I promise. But I've no doubt that I have gained in so many ways from this programme and the engagement with the Coaching Academy. I've shared time with a wider group of services, all tackling their own challenges, and I've learned a lot from the district nursing staff that I work with. I've had readily available coaching and supervision, and that has just helped me question again what we do every day. Thanks.
Thank you, Anita. I'm now going to hand over to Alison. After Alison, there will be some time for questions. Alison, are you ready?
Hello there, yes, I'm ready. Can you see the slides okay?
Nope, doesn't look like it.
They are up on my screen.
You want to click on the small arrow pointing upward icon and share your PowerPoint that way.
Oh, yeah.
And thank you for joining us, Alison.
Fabulous.
Are you there? Excellent.
Now.
Well, thank you very much for having me. So I am Alison Jones. I'm the West Midlands Academic Health Science Network Fellow in Learning from Excellence, which is the initiative that I'm going to be talking about today. And Learning from Excellence, at its heart, my slides aren't moving on.
Maybe if you want to just pop them into slideshow mode.
It is in slideshow mode.
There we go. There we go.
Oh, right. Sorry, I've put it back again now.
Yeah, that's right.
Okay, right. Sorry, folks. Thanks for that. Okay, so Learning from Excellence is an initiative that was started in 2014 by Adrian Plunkett, who is an intensivist at Birmingham Children's Hospital. And it has two main aims: to understand and learn from what goes well in healthcare, and to boost morale through positive feedback to staff. And why do we think it's important to look at what is going well? If this chart represents all healthcare interactions, our prevailing approach to safety and quality improvement in healthcare is to investigate and analyse incidents and accidents, highlighting problems from which we hope to learn. But as you can see from the chart, actually accidents and incidents form a very small part of everything that we do every day, and we are missing an opportunity to learn from the rest of our work, which we like to term everyday excellence. It's either fine or good or great or really excellent, and we're missing a trick by not examining that work a little bit more closely. As human beings, we unfortunately have an innate negativity bias. We've evolved to avoid risk and harm and to notice when there are errors. And our training is a prevailing problem-solving approach. So if I ask you to look at this slide, what do you see? Most people actually say, well, 3 plus 3 does not equal 7. But there are 4 correct sums here, so potentially 4 times as much useful information as there is mistakes and errors. And this is another one, everybody, there's nothing worse than misplaced apostrophes, and all of the errors jump off the page at us. So I'm going to talk a little bit about the availability heuristic, which is the tendency to estimate the probability of something by the ease with which it comes to mind, so that if we only focus on problems, errors and harms, then it's likely to loom large in our consciousness, and we're likely to think that lots of things are going wrong. And so another way I like to get people to think about this is to ask, what do you choose to keep in the conversation when you're at work and in your interactions with your colleagues? What do you choose to talk about in the coffee room? Is it everything that's gone wrong today, or is it something really excellent, or a colleague that's gone the extra mile to support you in this difficult day? So what we focus on grows. What we spend our time thinking and talking about is the thing that looms large with us. Also, as human beings, we tend to feel more pain from loss than we feel pleasure from gain. Loss is more impactful than gain. And as Jim Connors famously said, I hate to lose more than I love to win. And I don't know if you have heard about this second victim effect, but essentially it's this. None of us goes to work to make mistakes, but really due to the complexity and the pace of the environments in which we work, unfortunately, things do sometimes go wrong. So the person who's been harmed by an incident or an accident is the first victim, but I'm sure you'll all identify with that feeling of being the person that's been involved as a professional in an error or causing harm, and we are in that situation the second victim, that absolutely dreadful feeling where often through no fault of your own something quite damaging has happened. The other thing I'd like to talk about is incivility. The way that we choose to speak to one another affects performance. And you can see from these statistics, it's a little bit small on this screen, but you'll be able to see it if you download the slides, is that if somebody is rude or aggressive at work, the person on the receiving end of that unpleasantness has an average reduction in cognitive ability of about 61%. We can't think straight when people are being unkind to us. And I just want to introduce this group, Civility Saves Lives. Dr. Chris Turner is an ED doctor in Coventry in Warwick, and they've got a website that has lots of information about how important it is and how in fact respect and civility are safety issues. Another way of looking at this is actually to look at what we benefit, how we gain from being respectful and kind to one another in work. It's the same message really, but kind of being drawn to what we can benefit from rather than what we want to avoid. And then I'd like to also mention our colleagues at Sign Up to Safety, who have established lots of information about the fact that safer care is only possible if we care for those who care for the patients. Okay, so how can we capture and learn from this everyday excellence? Excellence reporting is the way that we go about it, and we've got an online form. You just log on to the intranet in the hospital, and if you have seen or witnessed some qualities or actions in another person at work that you value or appreciate, you write down what happened and you write down why you thought this was excellent, and the person being appreciated receives a personal email direct to their inbox and gets this message that what they did today has made a difference or helped a colleague. So it's really very simple, and it lies alongside the instant reporting system, so you can just log in the same way. And in fact, often, lots of excellence reports come through at the very difficult times, because it is often when people do go above and beyond and show their caring, compassionate qualities. So I've got an example here that I'd like to share with you. So on a night shift, which was very busy and demanding, Sister was so supportive and accommodating. Sister did this in a way as not to highlight I had differing needs from others. And I think that taps into the psychological safety that we were hearing about before. So not being made to feel that you're a burden or less capable than other people, but being supported to the level that you require support. And I think the other thing that it taps into is the idea that we don't often get reports about competence, clinical competence. What we get reports about is the manner in which we carry out our competent work. So the kind of soft skills of compassion, kindness, the way that we're managed, the way that we do things, rather than what we actually do. And here's another nice example. Showed excellent skills when assisting in an emergency tracheostomy change, eased mum's anxiety. Together we showed the parents that emergency tracheostomy changes don't have to be an emergency buzzer pull and medics around, because mum was going to have to do this herself at home. And so the manner in which we competently and compassionately allowed this situation to be resolved safely was giving mum confidence for when she went home with her child with a tracheostomy. So that's the kind of stuff that we hear. And moving on from the report itself, we do actually do a follow-up meeting quite often using something called appreciative inquiry, so that we if you like, it's something of a root cause analysis of what has gone well, in the way that you do a root cause analysis of incidents and errors. And the reason that writing reports and sharing stories of what's gone well is so important is because stories stick like glue. We use different parts of our whole brain to think about and identify with the people who are telling stories, and they convey values and vision, and they're very human and hopeful. And I'd like to direct you to an organisation called Appreciating People, who's helped us a lot with our training in these techniques. So appreciative inquiry began in the 1980s, a guy called David Cooper-Ryder, and he said it's a process for helping people build the kinds of organisations and worlds that they want to live in. And it's working from strength, so not an incident report, but a positive report about something that was perceived to be excellent, and we examine that a bit more closely and build on it. We do talk about challenges within this, but moving on to ways of overcoming them and making improvements. So this is the process of appreciative inquiry. Again, I'll draw your attention to the website at the bottom of that page, where you can get lots of information about perhaps learning some more about this right cause analysis as opposed to root cause analysis. And finally, when you have used these meetings to think of improvement ideas, I'd like to direct you to moving away from a SWOT analysis, which is strengths, weaknesses, opportunities and threats. And we've dispensed with the weaknesses and threats, and in their place we have opportunities and resources. So when you're making improvement plans and strategically planning for the future, you can do it from a positive core and based on your assets, what you do have. So moving away from SWOT and towards SOAR. So I hope I've given you some hints and tips there, and some websites and other information to have a look at. But as I say, compassionate kindness, all of those soft skills, psychological safety, they really are safety issues, and we perform better in an environment and a culture that acknowledges this. So thank you very much for listening.
Thank you, Alison. And it's Mandy again. And thank you to all of our speakers. That has been really helpful. I think if anybody has any questions, you can either raise your hands or put them in the chat box, and Charlotte will read them out for us, because I haven't got my reading glasses on and I can't. But I think for me, the whole session brings together what we're trying to do. which is to move away from the negativity of the culture that most of us have inherited rather than designed, and to create something that we would want to be and want to work in. So all of the work, both from the Coaching Academy, the work that Anita's doing, and the work that the Learning from Excellence are doing, is around leaving people in a better place than where they started, and capable of doing and changing things for themselves. Would the speakers think that that's a fair statement?
Absolutely. Yeah. I intend to go through Alison's presentation again, and that will be next year's work.
Yes, I mean, I think what we found with Learning from Excellence is that when you show people, when you are overtly talking to people about what they do well, they feel motivated, they feel the appreciation, and they do more of it. And that's how it becomes, you know, the way that we do things around here, it becomes the culture.
Yeah. We have got a question from Mark Hellaby, and his question is, with respect to excellence reporting, have you considered using human factor investigation tools such as FRAM, HFACS, etc., to analyse what went well and learn and feed into the whole Safety 2 agenda? And for those of you who, while I leave the speakers to have a chance to think about that, for those of you who don't know what Safety 2 is, that is that emphasis on looking at what works and what stops things from going wrong, as much as it is at looking at what has gone wrong and what we can learn from that. That is my summary of that. Any thoughts?
Yes, this is Alison. So Adrian and I attended the FRAM workshop in Cardiff last year, exactly for, you know, that reason, that we felt it aligned very well with Learning from Excellence. And we haven't used it consciously. We've had other plans and publications that we've been working on, but yes, we very much enjoy the work of Eric Holnagel, and it ties in very, very closely to our work. Yeah.
There's a question from Hannah Little, which is, has Learning from Excellence been spread and adopted elsewhere?
Yes, so my role this year, funded by the Academic Health Science Network, has been to travel around. I've been to Glasgow, London, all kinds of different places. We were in Amsterdam last week, giving this information. We've also done a Health Foundation funded project where we've generated some evidence following an improvement project, where we've shown how Learning from Excellence can modify behaviour and improve outcomes. And yeah, so next year I'm funded again by the Health Foundation to carry on going out into different organisations and sharing this technique with people. So yeah, very happy to talk if anybody would like me to.
I think that's great to know, Alison. I think also locally we have seen some trusts adapt a kind of Learning from Excellence light model, so where they do take the idea of reporting things that have gone really well or things to be proud of, without actually formally adopting the whole Learning from Excellence system. And I think that's quite interesting as well.
Yeah, I mean, I think essentially it's a philosophy rather than a, you know, you will absolutely do it in this fashion. I think it's just understanding really the idea. Yeah.
It is a mindset. The other thing I wanted to say is that, Mandy, I liked how you said we inherited these cultures, right? Yeah. And it's a good reminder that they took many years to get the way they are, and that there's not a silver bullet that turns things around right away. So it really is all about adopting that mindset and sharing.
The NHS was 70 last year, and it took us 70 years to get to where we are now. I'm hoping it's not going to take us as long to turn it around. And there's one more question for Alison, and that's, can you share the Health Foundation funded evidence? I'm presuming that's going to be published at some point, Alison.
Yes, we are writing. I mean, I do have some slides on it, and I hadn't quite. I can share perhaps a presentation that I can give to you to upload to your website, because it has been presented at a number of.
Circulate them offline if that would be better.
Yes, yeah, I've got a number of slides, and it was based around antibiotic consumption and antibiotic stewardship, so ensuring that prescriptions were excellent and antibiotics given in a timely fashion, but then also de-escalated. And we exclusively positively reported clinicians for their good work, rather than, you know, telling them how many things that they'd gotten wrong this week. We showed them when they'd done good work, and we conducted appreciative inquiry interviews to help them understand what motivated them to do that well. And we decreased antibiotic consumption by 6.5% over a 6-month period. So in a formal improvement project, we found that learning from excellence can actually have some tangible outcomes.
That's really great. And we've had a question from Mark about the ED checklist, so we will contact you offline about that, Mark, if that's okay. We've got one more question, and I can't see it, because it's tiny. So a question from Amy Harvey. She's currently working in a quality improvement role within Mersey Care, and was really interested in how she could support her colleagues. So they're working on the just and learning approach, and she was really interested to hear more from Anita. So we can put you in touch offline.
That would be great. I'm particularly interested, and so are our nurses, in your support around the Being Open process. So please contact me.
I think
I'd be delighted. It's actually what our district nurses are asking for at the moment.
So Mersey Care are doing some really interesting things around just and learning culture, and I know that they've rewritten a whole host of HR policies and investigation procedures and all sorts of things. So maybe there are things available on that. If people are particularly interested, we can come back to it. But that's all the questions we have for now. So unless somebody else has got one, may like to raise their hand, I think we'll probably call it a day for today. And thank you all very much for participating. And again, a great big thank you to our speakers for a really interesting session.